If you're a provider working with patients with endometriosis and/or interstitial cystitis, or you or somebody suffering from that, you may have come to realize that you experience lower abdominal pain and pain centered around the bladder. Particularly, it's important to have a really comprehensive approach to managing that lower abdominal and bladder pain because it can have several different drivers. And that's where it's important to have providers on the team to help cover different aspects of that pain, including a pelvic health physical therapist or occupational therapist, urologist who's knowledgeable in interstitial cystitis, and an endometriosis specialist who can help manage the medical aspect. With bladder pain, it's possible that they need to be taking a medication or an aloe supplement. We've got one with aloe and D-mannose to help protect the bladder lining, which can make a world of difference to help manage the inside of the bladder. And then additionally, from an anatomical perspective, looking at possible musculoskeletal drivers of that bladder area pain that may not necessarily come from what appears to be the pelvic floor is the deeper aspect. So here's rectum, vagina and uterus in the middle for those that have it, and bladder in the front. And then when I take those out, I'm looking at the deep pelvic floor. The pelvic floor muscles do wrap all the way to the back side of the pubic bone, and they can be tender and they can be very tight because of a protective or a guarding mechanism, and that can feel like bladder pain in the presence or absence of interstitial cystitis. So managing the pelvic floor all the way up to the pubic bone is really important, and we can do that manually as providers, and then patients can also do it using the wand. They can use this curved angle right here to go in vaginally and come right up and under to help address any restrictions or adhesions or trigger points or tender points in those deeper from the vaginal opening areas of the pelvic floor. And then additionally, it's also important to recognize that there might be endometriomas on the bladder itself, on the bladder wall, or in the pelvic floor muscles embedded around the bladder itself that are driving pain and that need to be managed from that medical aspect and perhaps done surgically for excision to remove that tissue. So from a pelvic provider standpoint, if we're doing therapy and we're addressing manually those areas and they're not changing in nature, the patient is not experiencing a decrease in pain or a change in the sensation of it, we need to be suspicious that there might be endometriomas in and around that bladder and be working and communicating with the endometriosis specialist who hopefully specializes in surgical techniques, because it's possible that they need to do some laparoscopic procedures to help manage that. And then additionally, working on calming the nervous system, stretches and relaxation for general pelvic health maintenance and overall nutrition, working with a nutritionist to determine what particular drivers may be enhancing that bladder pain. It's not always the same for every person, but common bladder irritants are caffeine, alcohol, spicy foods, chocolate, highly acidic things. But every person is unique in what drives their bladder pain. So looking at it comprehensively is really important, using tools that you have available, and also working collaboratively in healthcare.